Thank you for being here. My name is Dr. Chris Simpson. I'm the Executive Vice President Medical and Chief Medical Officer at Ontario Health. We're currently experiencing extraordinary pressure in our pediatric system. We're facing a triple threat of 3 viruses: COVID, respiratory syncytial virus or RSV, and influenza, all at the same time. Unusually high numbers of children are coming into hospital emergency departments for one or more of these viral illnesses, and the total number of these children that require admission is uncommonly high. While our hospitals have been preparing for this triple threat, we, along with much of North America and many places around the world, are seeing high numbers of these seriously ill children and seeing them earlier in the season than had been expected. Although this current situation is unlike anything we've seen in the pediatric population in recent memory, we have strong systems and structures that have been put in place during the pandemic for our adult community that we're now utilizing for child and youth care. We're taking action to ensure that these sick children get the care that they need. As we've done before, we're taking a Team Ontario approach, ensuring that all of our provincial resources are being used to support pediatric patients across the province. A team of experts meets daily to ensure that we're maximizing our health system resources. This team works with hospitals and regional incident management structures to support and coordinate care. All hospitals and their emergency departments have implemented surge plans to increase bed capacity and refocus resources to deal with the influx of pediatric patients. The number of available pediatric ICU beds is being monitored closely. It is very fluid and changes rapidly as children are admitted and discharged to a ward bed when clinically safe to do so. What is important to emphasize is that all pediatric patients will be seen when they come to a hospital. If they require admission, then we will look after them. But in order to do this, other parts of the health system will be impacted. We're already seeing a reduction in scheduled surgeries and procedures, and this will likely continue as we reallocate our resources to focus on pediatrics. We're also watching for the impact the flu may have on older adults. Our ability to manage this effectively will require all hospitals, both pediatric and adult, to work together to coordinate care. Our structures allow for this coordination and this real-time situational awareness so that the best decisions can be made. Dr. Moore will outline measures parents should take within the community to keep their children and themselves safe. Should your child become sick, parents should seek care through their family physician, go to a cough, cold, flu, and COVID assessment center, or call Health Connect Ontario, and if concerned, do not hesitate to bring your child to your local emergency department. While it's important to acknowledge that the system is extraordinarily strained, I have great faith and confidence in our healthcare providers across the province. They are expertly trained, and they will do whatever it takes to make sure all of our children get the care they need. Thank you. Dr. Moore.
Good morning. I would like to thank Dr. Chris Simpson for being here today and providing Ontarians with an update on the extraordinary pressures facing our health system and the actions that Ontario Health is taking to provide additional care in the pediatric system, specifically for children under 5. The ongoing circulation of COVID-19 in our communities, in conjunction with the earlier than normal rise in influenza and respiratory syncytial virus, RSV, is a situation not seen before, but is being experienced across the Western Hemisphere. Seasonal influenza activity is fully underway, with the percentage of respiratory tests that are positive now at 14.5%, up from 10.3% just 1 week ago. Current percent positivity for RSV is at 6.4% in Ontario, but has been increasing over several weeks. While our COVID-19 percent positivity has been decreasing, it remains high at 14.2%, and sustained activity is anticipated due to the emergence of BQ.1 and BQ.1.1 Omicron subvariants. What we are facing is a triple threat that requires our collective action, an action to protect the most vulnerable in our communities, the very young, the very old, and those with underlying medical issues, and to ensure that our healthcare system remains able to care for Ontarians when they need it. I am reminding Ontarians to get back to using all the layers of protection that we know work to keep ourselves and others healthy. We should all be screening daily for signs of illness and stay home when you are sick. Always practice good hand hygiene and regularly clean high-touch surfaces, which is especially important for RSV and flu viruses. Stay up to date with your vaccines. Get your COVID-19 bivalent booster dose and your flu shot. Both are safe and effective and can be received at the same time. This year's flu vaccine appears to be a good match to the dominant circulating strain, which is influenza A, H3N2. So we anticipate the vaccine being able to decrease your risk of being hospitalized for this virus. Influenza activity is increasing across Ontario. More than half of children 5 to 17 years old being tested in emergency departments and hospitals are positive already for influenza. I'm asking Ontarians, especially children 6 months of age and older, pregnant individuals, families and caregivers with young children, healthcare workers and elderly and those with underlying health conditions to get your flu shot as soon as possible, protect themselves and those around them. The best way to prevent the flu is by getting the flu shot every year. You can also get your COVID booster safely at the same time for those over 5. With the peak of flu season expected in early to mid-December, the time to get your shot is now. Please, please do not delay. It is not too late to get protected. And in response to the worsening trends and existing challenges for our healthcare system, I'm strongly recommending that all Ontarians, not just those at high risk, wear a mask in indoor public settings, especially around our most vulnerable Ontarians, the very young and the very old. I'm also recommending that, if possible, children between 2 and 5 wear a mask with supervision if they can tolerate the mask and safely put it on and off. Applying all these layers of protection will help to protect ourselves, our families, and most importantly, our children under 5. It is our youngest children, those under 5, who are especially vulnerable to severe outcomes from RSV and COVID and influenza. And we need to ensure that we take all the necessary steps to keep them safe. When it comes to RSV, while it is a known seasonal virus, it is highly infectious, is a major cause of respiratory illness in infants and children. Over 20% of children under 1 year of age have tested positive in the emergency departments and hospitals for RSV. Because RSV, influenza, and COVID-19 symptoms can all have varying degrees of symptoms from minimal to severe, it is important for everyone, including parents, grandparents, and other adults, to pay attention to the symptoms and avoid spreading it to others if they are sick. Older children, siblings, parents, and adults can easily pass on the infection to high-risk children through close contact. That is why, if possible, it is important to keep babies away from people with any cold symptoms. If not possible, anyone with symptoms should wear a mask and practice the layers of protection around our most vulnerable. Keeping our children, babies especially, away from crowds will also help minimize the possibility of infection. The higher the number of social contacts, the higher the risk as we go indoors for this very social time of year. Please make sure your child receives all the recommended childhood immunizations. There is no vaccine yet for RSV, but staying up to date will protect your child from other causes of vaccine-preventable respiratory infections. Pregnant individuals should consider being protected for themselves and their newborn by being vaccinated during pregnancy against influenza, COVID, and pertussis. The vaccines protect you and your newborn. RSV, influenza, and other respiratory infections. Sorry, the teleprompter stopped working. Can develop severe illness and may need to visit their healthcare provider or go to an emergency department. The difficult and complex fall that was predicted has materialized as we deal with three major viral threats: COVID-19, influenza, and RSV. All three are actively circulating across Ontario in all of our communities and across the Western Hemisphere, contributing to the pressures on our pediatric healthcare system. As the risk to Ontarians increases, we must use all of the layers of protection that we have. I'll stop there and happy to take questions.
Dr. Moore, this of course has ignited a raging debate about the merits of masking. Should it be mandatory? Can you explain why you're not going one step further and making masking mandatory?
So part of my responsibility as a Chief Medical Officer of Health is to inform Ontarians, and I think the first step is educating. It's not just COVID-19 anymore. We are dealing with the complexity of COVID-19, influenza, and RSV. And I'm very concerned that children are being admitted to our hospitals and are in our intensive care units, principally 4 and under, that cannot mask. So everyone around them, the parent, the sibling, the grandparent, I'm urging them to protect the most vulnerable of us, our children, by adhering to all the layers of protection. What might be a cold to you can lead to a severe respiratory infection in a child 4 and under. So there is a complexity now that it's important that all Ontarians understand, and we have to get back to the basics. If you have children and you yourself has a cold, that can be a serious and significant respiratory illness in a 2-year-old or 3-year-old. So as we go indoors, my principal message today is to protect our children, follow all the layers of protection. Our hospital system needs us to protect our children more and more. And it's not just masking, it's the layers of protection. If you have any symptoms of infection, you should mask around those that are the most vulnerable to our individuals. You should be screening on a daily basis. Good hand hygiene is going to be exceptionally important with RSV and influenza. It's a call to vaccinate against influenza and COVID, as there's no vaccine against RSV. We need to protect our health system. We need to protect each other, and it's really getting back to all of those basics. We need a reboot, a reminder of what will keep us safe for the rest of the winter season, and today's the key message of getting back to the basics of protecting our most vulnerable. This is different than COVID. This is protecting our children and those that are the youngest above us. Please, parents, grandparents, siblings, if you have any respiratory symptoms, you must mask around those that are vulnerable. Masking mandatory masking in a certain venue may help decrease the risk at a community level, but I'm very concerned about our children and protecting our children right now, and it's best that we protect them through masking in the home environment and in any social situation as we go into what will be a very social environment in winter.
So do you expect compliance? Because you're urging this, but you're making it voluntary. Do you expect the majority of people to comply? Because if you go on the TTC now, and this message has been circulating for a while, the majority are not masking.
I certainly hope Ontarians will heed the call. They've done brilliantly in the last 3 years, the last 1,000 days of COVID. This is new, though. This is a new call to protect those that are the most vulnerable around us. So a mask in a mall will help diminish the community spread of these viruses, but we need us to mask around those most vulnerable in social settings, which mandates haven't worked for in the past. At family gatherings, at family social situations, we have to mask to protect those that are the youngest among us, those that are 4 and under. I spoke to Dr. Cohen, the CEO of Hospital for Sick Children, yesterday, and I'm very sorry to say that half the children in the intensive care unit ventilated right now have RSV and half have influenza. Those two can be diminished by masking around our most vulnerable, our children, in our home situations, in our social situations. Yes, masking at a population level will help, but we really need to focus where we can protect our children, who are the ones under 5 getting admitted to hospitals as we speak.
Dr. Moore, will you be recommending to the government to let school boards implement their own possibly mandatory masking policies as they see fit, or recommending otherwise about the school boards?
I have no jurisdiction over the school boards and what school boards put in place, so I think they can consult their local medical officers of health. I typically don't speak directly to school boards, but they can take into consideration the local level of activity. Siblings can bring the virus home to younger members of our community, those that are 4 and under, and it may be one tool of a component of tools that can help diminish the spread to the 4 and unders. Principally, the message message today is that our 4 and unders are the ones that are being driven to hospital, that have to get admitted to hospital, and we need to decrease the burden of illness, to slow the chain of transmission of these viruses, to make sure that we can care for all of our children in our communities.
You're talking today about getting back to basics, but I'm sure this, for people watching, this might seem like Groundhog Day in a way, of what we've experienced the last 2+ years. What's the line this fall in terms of how far, how strict of public health restrictions you're willing to recommend? You know, is it the sort of things like, could capacity limits come back? Could those limits in private gatherings? How far are you willing to go this fall, given the larger context?
We are taking it day by day. We're watching the data, as you have heard from Dr. Simpson, on a regular basis. We're speaking almost daily together to monitor the capacity of our healthcare system to care for our children. The principal tool at hand, if we had to go there, would be a mask mandate. Clearly, for social gatherings, I'm asking today that we be very careful around our children 4 and under. A cold or a minor respiratory symptom, a sinus infection to you, could be RSV or influenza to our younger members of our community and cause significant respiratory distress in them. So that's the key message. It's hard to mandate those social environments. That's my job today, is to educate Ontarians that this is a change. This isn't COVID that's affecting our children, although it obviously can. It's RSV and influenza combined that are driving our children to have to be admitted to hospitals. And we do have the tools at our disposal that can help protect our children and help protect our families. My concern is that this is spreading in families and in social situations outside of the large public venues. And it really comes down to families, grandparents, parents, siblings protecting the most vulnerable and youngest in our communities.
Just for clarity's sake, is a mask mandate the furthest you want to go, or you will
I
go?
honestly think a mask mandate would be the furthest we'd have to go. Ontarians have been brilliant to adhering to all of the recommendations over the last 1,000 days of the pandemic. This is new, and I really appreciate the opportunity to speak directly to Ontarians through you, to communicate that increasing risk, that increasing pressure on our healthcare system, and it's important to know it's not across all age groups. It is the youngest that cannot mask or would obviously have difficulty in masking, and we need to protect them. It's 4 and under that are really having the increased risk of hospitalization and to be in our intensive care units today.
I just want to be clear, so if I'm a mom to, let's say, a toddler, and I wake up with the sniffles, you're saying I should be masking at home?
I'm sorry, but you should. You should be doing good hand hygiene, cleaning surfaces, masking as best you can to decrease the risk to that child. As a mom, the other things you can do is now bring your child to get immunized against COVID and influenza. That will have a definite benefit and protection to your child. But anyone with respiratory symptoms now, it may be minor for an adult or an older member of our community, but it can be major for a child under 4 in particular, as we're learning day in, day out across Ontario.
I know you talked about this as being more like the social interactions, the home interactions, but kids are spending the bulk of their time in school in a child care setting unless they're at home being cared for. So why not go that step if the goal is to protect those youngest kids, to introduce a mandate in schools specifically?
So we are discussing that and reviewing that as a potential, but clearly today's message was for all Ontarians to realize that it's RSV and influenza that are driving the admissions of children, that there are tools at our disposal. We've been moving in an incremental way. 2 weeks ago I spoke to you about the highest risk individuals, a call to get vaccinated and a call to mask up. Today it's mask up to protect our children who are the most at risk to being hospitalized now. And we do have tools at our disposal that can work. And I'm calling on all families, in all social settings, as we go into a very social time of year, to please, please, please be careful around our most vulnerable citizens.
Dr. Moore, is there, you say you're looking at the data, is there like a trigger point where you would initiate a mask mandate?
Yeah, we're absolutely watching it day by day. In regular contact with the pediatric leadership and Dr. Simpson and all the leaders at Ontario Health, as he said. And Chris, I don't know if you want to reiterate what they've been doing from incident management across Ontario. We are trying to increase capacity of beds day in, day out across Ontario, knowing that, as I've said, we're at 6.5% positivity for RSV. Quebec is at 20% positivity and has ever increasing demands beyond us on their healthcare system. So we're learning from Quebec, learning across North America on how best to care for our children and build capacity across the system. If that capacity is threatened, that is when we'll be advising further to government. At present, we're at 100%, and the call is across Ontario to protect our children and most vulnerable.
Dr. Moore, many doctors have been telling us for weeks and weeks that the health system is already collapsing, especially in terms of pediatrics. And many people in this room have interviewed these doctors and done that story for weeks and weeks. Why did you wait this long to make this announcement when things are already collapsing, people are already at the brink, people are already waiting hours and hours with their kids terrified in an emergency room? Why did you not make this announcement weeks ago?
But I think Dr. Simpson will tell you the health system has been working full out to provide additional care to children, to increase capacity in our emergency departments. As Dr. Simpson has said, the clinical assessment centers, now over 80 of them across the province, can now assess children and adults and can provide the Paxlovid, the antiviral for outpatient COVID. They can also provide Tamiflu for outpatient care for influenza and can assess children. So we've been trying to build capacity and to ensure that all children can be cared for. You're absolutely right. We're at a threshold, but we're not stopping now to build capacity to care for our children. And I think I've been fairly consistent about getting immunized, protecting our children, getting immunized from 6 months of age and up for COVID as well as for influenza. It takes time for some of this messaging to get across, but I very much welcome the opportunity today to tell Ontarians to get back to all of the basics and to inform them of the ever-increasing risk of RSV and influenza in our community and for our children. If we have to move to anything further, it'll be based on the best data, the best evidence, and be informed by Ontario Health's capacity to care for our children.
I was just going to ask, getting buy-in is key because, mask mandates are not enforceable. And as you point out, you could never have a mask mandate at Thanksgiving dinner and police it. So are there other tools you can use to, like you're appealing to today, to effectively save the children? What do you think people are not understanding about this? Because, like it's been mentioned earlier, I take the subway every day, hardly anyone wear a mask. Can't imagine they're wearing them at home. So what's the chief obstacle here for you getting this through to people?
Well, I think we have to educate. That is the basic premise of our public health communication at present. I don't know if all parents realize that a common cold to them can be a serious and severe respiratory illness to someone 4 and under. We need to get that message across, that any respiratory illness in an adult right now can be RSV or influenza. They all have very similar early symptoms, and that can transmit to our children. We must now learn from the last several weeks of experience in Ontario and around the globe to protect our families further. So always our first basis in public health is to educate, to provide the facts, to provide the options and tools to protect our children and our communities. The message today is really just getting back to those basics. They will work. They have worked over the last 1,000 days. We have been able to decrease the burden of RSV and influenza through all of those key layers of protection of masking, hand hygiene, staying home when you're sick, masking as you recover. Those basics will get us through. And I need more Ontarians listening and more Ontarians protecting our most vulnerable in our communities.
Can I ask
I have
about
a
capacity?
one-year-old at
Can I ask
home?
about capacity for a bit? It sounds like perhaps, like the first round of COVID, there was an attempt to get hospitals ready, acute care hospitals, and the province got hit in LTC. It sounds like this time we did the same thing. We got acute care capacity ready. Did we not expect to get hit in pediatrics? Was the RSV issue a surprise? What happened there?
Well, I think every wave of the pandemic so far has had its own unique signature, as you suggested. We've had At the beginning, the pressure was around personal protective equipment. Then by wave 3, there were big ICU pressures in adult ICU. Later on in the pandemic, the pressure seemed to be on the wards for adults. Now the signature, and ironically it's not COVID this time, it's RSV and influenza, is on pediatrics. We've been seeing between 200% and 300% increased numbers of respiratory symptomatic presentations to emerge. We've seen the ICUs be filled to capacity for pediatrics. We've seen the community beds, the 29 hospitals across the province that have pediatric beds, those have gone essentially to full capacity. And the system is now working in a coordinated way to try to increase forward flow, make sure that as kids recover from their illness and their ICU stay, so that they can get to the ward quickly. That forward flow is in turn creating capacity for the kids that are becoming sick. So yes, the capacity has been built, but we're now sort of at capacity, and we're now into mitigating factors. And to the earlier point that was made around how to motivate people, the other thing I would add is that certainly the message around protecting the kids, I think, is a very powerful one. The other message is that it can't be forgotten that in order to accommodate this, and we will accommodate it, but in order to accommodate it, other things have to stop. And you'll recall over the summer, there was a lot of conversation around how we were going to recover surgical backlogs and all of the deferred care. So we can't forget that this kind of extreme pressure on the system is going to create more of those kinds of deferred care in less time-sensitive areas that are going to need to be caught up. So for those out there who need some motivation to help protect the kids, remember that the healthcare system needs to be there for everybody, and for it to be firing on all cylinders, we need to be protecting the system now from this extreme surge.
Is there enough capacity for sending kids, I think it says in your deck, 14 and over to adult hospitals? How much will that help with the pressure, be it Sick Kids, CHEO, MAC, London?
It's a help, but it's a small amount. The number of kids that are in hospital and in ICU who are over 14 are typically a small proportion, and probably will be a shrinking proportion, because most of the new kids coming into hospital requiring ventilatory care and ICU care are going to be the younger ones, as Dr. Moore has outlined. So it's one of those, every little bit helps. And certainly it's not new for 14 and 16-year-olds to be looked after in adult ICUs. That's commonly done, for example, in some of the non-pediatric ICUs where a child would have been in a motor vehicle crash, for example. They would typically complete their ICU stay in an adult ICU if that were the closest one. So we've simply asked the system to make this more routine so that we can squeeze out that extra capacity, reserve the capacity in the specialized pediatric ICUs for this wave of respiratory illness that's coming, that's here and will continue to come.
If you're a parent, I think parents really, especially if you have a couple of children, say one that's 2 years old and staying at home, and then you have a 6-year-old that's in school. If you're a parent, would you try and get your 6-year-old to voluntarily wear a mask? Like, what should a parent do in this situation?
Yeah, if you've got any vulnerable child in the home, I think it's best we, in essence, try to cocoon that child with masking as best we can. 4 and under are very susceptible to RSV and influenza. Well, first, if you have any symptoms, absolutely you should be masking in the home setting and staying home until you're fully recovered, practicing good hand hygiene in the home setting. But if you've got anyone vulnerable in the home, it's best, as the risk goes up for all 3 of these pathogens, all 3 of these significant viruses, to mask around anyone vulnerable.
But then what does that mean for daycare? Should daycare staff be masked? Should children then voluntarily be masked in schools?
We're asking more people to mask up, and that's one of the key messages today, especially around our most vulnerable children, 4 and under. And if we have to put that as an order around daycares, we absolutely will consider that.
Do you have the legal
how long are
authority
you asking?
to impose mask mandates? And to Charlie's point, how long would you want people to do it? But whether it's population-wide or daycares or schools, do you have that legal authority without the province passing new legislation?
The Chief Medical Officer of Health has some authorities mainly over the health system. The minister of those respective jurisdictions, education, children's services, has jurisdiction over those services as well. If we had to mask up, we would do it based on best evidence, and we would follow it through clearly as we go into the most social time of year, going indoors. I'm very concerned that the risk is going to go up for our children, and we'll be monitoring that situation very closely.
So is mandatory masking inevitable? Are we heading into that direction?
I don't think it's inevitable. I do think the options for families and the best practices have been pronounced today of how to get back to those basics that will help protect our families and help protect our children.
So you've just spoken about just people masking around vulnerable people. Are you not recommending that people mask in all indoor settings? Is that not your announcement today?
Absolutely, with a particular focus on our children and protecting our children as best we can, because those are public settings. The social setting is where the virus is spreading within your family, your social system, your social network. So you're hearing there's a complexity. Masking in public spaces will bring the overall burden of influenza and RSV and COVID down. But if it gets into the family and affects 0 to 4s, that's the additional risk. So you have to mask in those public spaces, but be very careful around our children because this is obviously spreading in social networks as well.
All right, one last question. Thank you everyone for coming.